The National Cancer Institute was founded by the decision of the Council of Ministers of Thailand on the 28th of December 1965, with an international fund from the Japanese government under the Colombo Plan. His Majesty the King Bhumibol Adulyadej presided the opening ceremony and gave the name Damrong Niradun, meaning to be eternally rid of grief and sorrow, to the first building of the National Cancer Institute on Tuesday, December the 10th, 1968. Later, we asked permission from His Majesty the King to declare December the 10th as National Anti-Cancer Day. The vision of the National Cancer Institute is to be the nation's foremost leading cancer institute, and the mission of the institute is to develop new knowledge and technology for all cancer approaches in order to guide to policy recommendations and transfer this knowledge and technology to organization networks, medical personnel, and the public. The National Cancer Institute is committed to provide sophisticated medical services using appropriate high technology. The National Cancer Institute has two major duties: to be an institute to propose policy for national cancer control program and to be an excellent center for comprehensive services in cancer therapy. On the duty of making the policy for control and prevention of cancers, the Institute has been continuously making the national control and prevention plans since 1997. At present, the national plan is to use in the 2013 version, with implementation all health areas throughout the country. To comply with service plan policy, the main goal of the plan is to achieve a decreasing in cancer incidence and mortality, as well as waiting time for treatment. The plan was executed through 7 strategic moves: primary prevention, screening and early detection, cancer diagnosis, cancer treatment, palliative care, cancer informatics, and cancer research. At the Excellence Center for Cancers, the National Cancer Institute provides medical services on cancer screening and diagnosis with around 40,000 patients per year. The Institute provides cutting-edge technologies such as comprehensive gastroendoscopy services, digital mammogram, breast examination using gamma ray, and proactive countrywide service with mobile vehicle installed with digital mammogram machine. For cancer therapy, the National Cancer Institute provides medical services beyond the tertiary level of care, including surgery, chemotherapy, and radiotherapy. The Institute also has the Center for Transferred Patients from all over the country. Sophisticated therapies provided here include laparoscopy, oncothermia, and transarterial oily chemoembolization. We are one of the leading centers in Thailand that have high numbers of patients. The Institute also has the first of its kind, the intraoperative radiation machine in the Thai public health system. In the outpatients department, the Institute provides services with rate of 300,000 visits per year, and inpatients units about 8,000 cases per year from 200 servicing beds. Furthermore, the National Cancer Institute is the model institute for end-stage cancer palliative cares that provides at-home medical services through the end of life of patients. The National Cancer Institute has main areas of the cancer research for cancer control, with research outputs more than 20 publications per year from concerted national and international collaborations. The research areas cover basic science, clinical science, and technology assessment, including finding model development for appropriate cancer screening, such as finding new cancer biomarkers. The center also supports studies on herbal medicine, for example, use of sea holly, rhinocanthus, and turmeric, in cell culture and animal studies. Our clinical research studies are international multi-center studies, such as evaluation of new chemotherapeutic agents, new technology assessment, cost-effectiveness studies of diagnostic and treatment for appropriate uses in Thailand, and population analysis as a model to be used for the whole country. The National Cancer Institute is a training centre having more than 20 short and long courses for medical personnel. The famous courses are 2-year programs on subspecialty training for surgical oncology, 4-month program for nursing oncology, course on holistic approach for breast cancer, and Cancer Nurse Coordinator course for nurses from 12 health areas throughout the country to support service plan activities. The Institute is also a centre for exchange medical students, nursing students and residents from all major specialities. The Institute also continuously provides seminars and talks on cancer for the general public. The National Cancer Institute sets priority for cancer prevention based on the distribution of information and knowledge to all people so they can take care of themselves from the beginning. For example, we have 5 do's and 5 don'ts to keep cancers away, 7 warning signs of cancer, and a video on how to perform breast self-examination. The Institute also has wristbands and neckties for common cancer awareness, and a mobile phone application to get smart with cancer. The National Cancer Institute is an important institute in Thailand in promoting cancer-fighting campaigns. Some of the important events are a campaign on World Cancer Day on February the 4th, a campaign on National Cancer Day on the 10th of December, and special events on important cancers, such as colorectal cancer campaign in March, breast cancer campaign in October. Regarding duty on screening, we collaborate with the National Health Security Office to conduct cervical screening projects for 76 provinces. The project was proposed as national program since 2005. So all Thai women can have free screening test for cervical cancer that leads to incidence rate reduction of cervical cancer from number 1 cancer for Thai women down to number 2. The National Cancer Institute with all medical royal colleges and medical professional societies have combined efforts in introducing the guidelines for diagnosis and treatments of important cancers in Thailand since 2004, so all physicians and staff can practice with the same standards. As of now, there are guidelines that cover cancers in 7 different organs. The National Cancer Institute has been a responsible institute to conduct population-based cancer registry of the country since 1990. The institute has developed the software to keep records on cancer at the national level, and all participating hospitals throughout Thailand can submit data directly to the center. This data can also be linked to the Globocan website, so they can be shared internationally. The National Cancer Institute has made many memorandum of understandings with many organizations, both at national and international levels. For example, the Thai Institute has signed an MOU with the government pharmaceutical organization on the use of herbal medicine in a clinical study for cancer treatments. An MOU with Nagoya University, Japan, on establishing a research center for gastrointestinal cancers and set up a training center on early detection of cancers for ASEAN. One of the major duties of the Institute is to be connecting points for international organizations and ASEAN. The Institute has sent cancer registry experts and colposcopy specialists to arrange conferences for physicians and healthcare workers in Myanmar, Cambodia, Laos, and Indonesia. The Institute has many collaborative networks in cancers with many leading international organizations. Throughout the long and arduous commitment for best quality service and continuous quality improvement, the Institute has received many awards for individual staff and at organization level. We received the second certificate from the Thai Healthcare Accreditation Institute in 2016. We have been awarded the Best Moral and Ethical Institute by the Ministry of Public Health in 2015. And the National Best Service Award, the Distinguished Service Innovation Award in detecting frozen shoulder in breast cancer post-operative patients by the Office of the Public Sector Development Commission in 2014. The National Cancer Institute has committed for continuous development on missions of making policy for cancer control and prevention and being an excellent centre for providing complete management of cancers to successfully achieve the goal of cancer-free for Thai people.
สู่จุดหมาย